Pharmacology for nurses, let's talk about how to master pharmacology NCLEX questions. First, there's two parts to an NCLEX question, the context and the core. Understanding the context of a question, well, this is where all of the data lives. The first part of the question is going to provide you with background information, and this is where you'll find the subjective and the objective data that paint the clinical picture. This section tells you what's happening with the patient. You'll find information like the medication, the disease process. If it's described in detail, the focus is probably on this condition. Cultural or religious factors, if mentioned, this is going to be a key concern. Or symptoms. If this is emphasized, symptom management is probably the priority. For example, if the case states a client receiving penicillin IV, the question is probably about the medication. However, if the case states a client with pneumonia, crackles in the lungs, and an oxygen of 89%, the focus is on managing the disease, and you might not even need to know much about the medication to answer this question correctly. The core of the question is the decision point of the question. The core is typically the last sentence of the question, and this is where the NCLEX directs you to take action within your nursing scope of practice. The core is asking the nurse, which is you, what are you going to do with this information? A couple rules for the core of the question. One, it does not contain new subjective or objective data. You already gathered that information in the context. Only the action being asked of you is going to be in this sentence. Focus on key directive words, first, priority, best, most important, and use exact wording from the question. If NCLEX asks for the first intervention, evaluate the answer choices and decide which would be your first intervention as the nurse. You could even number the answer options in the order you might do them. How are we going to approach a question efficiently? Well, after reading the question twice, I want you to clearly decide what the core of the question is asking of you. Go back to the context of the question and pull out relevant subjective and objective data. Identify if the question is about the drug, the disease, or the symptom based on what is emphasized in the context. And then apply your nursing knowledge and choose the best answer that aligns with NCLEX prioritization principles. For example, if the question specifies highest priority nursing diagnosis, your job is to pull from the context and determine which issue is the most critical based on, for example, ABCs, airway, breathing, circulation, or Maslow's hierarchy of needs, or safety concerns. By breaking down NCLEX-style pharmacology questions using the context and the core of the question, you're going to feel so much more confident on test day. If this was helpful, my online course is designed specifically for nursing students to break down complex drug concepts, teach you how to analyze NCLEX-style questions, and give you the study strategies you need to pass with confidence. If you would like this digital course, you can enroll at the link in my bio and take the stress out of studying. Don't forget to like, follow, and share for more Pharm for Nurses.